Okay, Nick Seddon, there he is. How are ya?
Doing great, thanks. How are you?
I'm well, thank you. So hey, listen, thank you so much for being on this with me. I know you're in Tofino. Is it nice there? How's the weather?
It's very typical. It's overcast but beautiful. We're gonna go ride bikes along the beach, and so yeah, it should be fun. Hopefully, I'll get some surfing in this weekend. But I just wanted to be part of the outdoors and escape from Vancouver.
Yeah, get a little outdoor time. We're going to be doing that this weekend, probably in our backyard. But regardless, thank you for taking the time. Nick, for anyone watching this, is a friend of mine and a dear client, and we worked together for a number of years now. So it's always great to have you on when I can. You're also a wealth of knowledge in the dental world for me. You've taught me a lot over the years, and I always look to you for advice and what the latest and the greatest is. And when I find something cool, I always try to bring it to you and say, what do you think of this? So
I like my toys, so that's a good thing that you're doing that.
Yeah, exactly. I'm like, what do you think of this toy? You want to buy it? You're like, nope, I found a better one. I'm like, okay, cool. Yeah,
that sounds about right.
That's how we work. So I just want to jump right in. I want to be mindful of your time so you can get back to enjoying your time at Tofino. So jumping right in, the first question I had for you is, tell me about some of the changes you made. I mean, this whole COVID thing, I mean, here we are on, June 19th today. And I guess Dr. Bonnie Henry was saying that we're now on day like 101 or 102 now. So over the last 2 or 3 months, can you tell me a little bit about some of the changes you've made in your practice to keep your patients and your team safe?
Yeah, so we were fortunate enough, and I say fortunate because, we learned a lot from the experience. Like there was a number of us that got COVID in the office. We did not transmit it to any patients. We shut down the office right away upon getting tested, essentially. I was expecting not to receive a positive diagnosis, but then when I did, it freaked me and my wife out a little bit, but then we dealt with it and the symptoms were really minor. And then once I got the go-ahead from one public health nurse and I was okay to work, I went back out to work right away to start serving patients and serving the community. The amount of people going into the emergency room for dental related issues. And so we wanted to contribute to the influx of patients going to the hospitals due to COVID related issues, but we wanted to take care of all of the dental related emergencies. And so once I got all of the advanced PPE, I was treating patients almost right away. But of course, a safe time after my symptoms went away. And so what that allowed me to do is really learn about what works and what doesn't in the office. And I also studied night and day in terms of other things. Practice. And it's college requiring us, what are other colleges in other provinces and states requiring us to do. And so I really wanted to get an understanding of how is this virus transmitted, what should we really be concerned about. It says my internet connection is unstable, so I do apologize if it's getting choppy. But not only do we want to ensure the safety of our patients, we also want to ensure the safety of our team members. And so with that, we kind of put together a game plan to address everything. And so now we have, for all aerosol generating procedures, we're wearing isolation gowns. We are wearing shoes that are left in the office. We're all wearing scrubs that will be worn only in the office and not worn home. We are getting the Jade units from Surgically Clean Air, which is an advanced HEPA filter that will filter the air. And we're also getting unit from Display, which has a little mirror attached to it, and that'll allow our hygienists to safely use the Cavitron or any other aerosol generating procedure. But really, the biggest thing that comes down to the prevention of the virus from being transmitted is proper communication with our patients and screening them and ensuring that no symptomatic individuals come into our practice. And so we're calling them in advance, making sure they don't have any symptoms. And on the day of, we're also making sure that they don't have any symptoms a second time when we're speaking to them. So we have them fill out an informed consent form, ensuring they don't have any symptoms, and then also having them do a rinse with hydrogen peroxide 1%, and also washing their hands for 20 seconds. So with all of that, the screening, the rinse, the hand washing, social distancing amongst the team, contactless checkout system where we're not paying at the front, but if we are, we have the sneeze guards set up and the appropriate standing prints for where patients should stand. So with all of that, that's actually more than what the college has required us to do. And so we're following not only college guidelines, but also workers' compensation board guidelines. And then also taking ideas from other states and other colleges of other provinces, just to make sure that, even though we're safe to those levels, we also want to be safe just to provide peace of mind to our team members and also to our patients.
Mm-hmm. How's the response been from your patients? Are they noticing much difference? I mean, everyone's got the sneeze guards up now. Everybody's got, there's a change everywhere. So I think that everyone's pretty open to it. But have the patients have they been appreciative of that, of the steps that you're taking?
So it looks like it's, there we go. So yes, patients have been 100% on board with us. They've been really interested in coming in for treatment. We've actually had some patients that saw me on the news where because I had COVID and I have antibodies and I have some degree of immunity, the likelihood of my being able to pass this on to someone else is reduced. And so I had an immunocompromised patient come in who normally sees another dentist, and I was able to treat her just for membrane removal of a graft procedure. But it's those patients that need to be really careful, and so that's why she came in to see me. But generally speaking, I would say patients are very understanding. They also have confidence in us because we've always followed universal precautions, and we've all for infection control protocol. And during COVID times, the amount of virus transmission in the dental office is significantly low. Like it's incredibly rare to transmit this virus. I believe that there's been studies already done in Wuhan early on during COVID with thousands of dentists, and the infection rate is very low.
Well, because your standards were already so high to begin with, right? So, I mean,
exactly.
I've been in your office a number of times during COVID, and I just throw a mask on, and just to make sure that I'm not, a threat to anyone. But I mean, I'm obviously minimizing how much I'm in my clients' offices, but I walk right in, I do my thing, I have a chat with everyone, we maintain social distancing, and then I make my way out. So I certainly don't feel uncomfortable coming in. I always check with you guys to say, hey, before I come in, are we good?
Yeah.
And the team's been pretty supportive that way. And if there is an issue, if they feel that they're not comfortable, I just say, hey, make sure you let me know if you don't feel comfortable with it. We can always do it over text, over phone.
Yeah, exactly. And with now we have masks for the entire team all day, and that's something that we've implemented almost from the very beginning of COVID. So even our receptionists now have masks, and I think that's also important. But it also gives a good visual to patients to show that they know that we are taking this very seriously. Mm-hmm. And then also those patients that do want a mask, when they come in, we will also provide a mask to them if they're interested.
Oh, good. Can you tell me a little bit about the teledentistry side of things? Are you doing much there with over the phone, or are you doing any kind of virtual consulting as well?
Yeah, we're doing a lot of Zoom consults and even just phone consultations, but primarily Zoom. It's been very effective for us because what's interesting is that I feel like I'm still able to build rapport with patients, and you have that patient interaction that you wouldn't necessarily get on the phone. And then so when they actually come in for whatever procedure, or if it is a follow-up consultation in person, because of course we can't do everything over Zoom. We do have to look inside the mouth eventually. That's the one problem with teledentistry, is you can't do everything from home. But what it does is it really provides that first step in creating that relationship with the patient. And then also, if it's like a follow-up consultation after their first visit, that doesn't necessarily need them to come in, where we're reviewing the treatment plan, going over the financials for that, can all be done from home. So that if I can reduce a visit for the patient, not only is it convenient, it's also almost just as effective, because I can also share my screen with them, and that screen can include before and afters of cases I've already done, or their own photos, and we can actually go over their photos together. Or if it's for Invisalign, we can show them what a ClinCheck looks like and what the movie of before and after will be, and all the different movements and so on and so forth. So we're really able to get into the specifics of their proposed treatment as well.
And it's probably more cost effective, right? Because instead of putting on PPE to have an in-person consult, I mean, that's probably a bit more of a streamlined, easier on your pocketbook to see someone over Zoom, would it not be?
100%. But what's also interesting is the most expensive part of our office, if you're not aware, is time. And so time in the chair is very precious. And so what I find is that these Zoom chats 10 to 15 minutes for me, whereas if they're coming in, we have to do the initial phone call where we're bringing them in, we're doing the hand washing, the rinse, the informed consent, we're sitting them down, we're going over their issues with the assistant, then I'm coming in, and then I'm having the chat, and then they have to leave and they have to go through the checkout process. So it's 4 steps that we've essentially eliminated, and we've just done it over online. And so we can just jump right in, and I can have an immediate consult with them. We don't have to worry about COVID and virus transmission or anything like that. And we can just get down to creating that relationship and going over the needs of the patient and answering their questions and helping guide them to a solution that works for them. So I think that's the biggest cost savings for us, is the reduction of time. And so not only is it more convenient for them, it's also more convenient for us.
Mm-hmm. Yeah, and you and I have been working on this for a little while. I mean, with shameless plug here, with Dentist on Demand, obviously, and then with setting up now it is a HIPAA compliant Zoom account, and I have mentioned this on numerous podcasts, saying that Zoom got a bad name for a little while, a couple of months ago. But I think that it needs to be recognized that there is a HIPAA-compliant Zoom offering out there, which is what you're using. And I know because you and I worked on setting it up together. So the patients what do? They go to your website and they can just click on, there's a calendar that pops up with Calendly, and then they can pick their time that you've predetermined to have that consult with them, correct?
That's right. Or we just simply book a time on our schedule. It's either of those. But it's really convenient for them to book that with us. For the most part, we're doing it on our end, but I think we are going to add that functionality to our website such that patients can book it themselves. But to be honest, we've been just very busy addressing patients' concerns and doing these consultations. Like to have the control over it, so it's just a matter of just coordinating with our reception team here at the office. But as we get more streamlined, we'll eventually have it where they can set it up through the website as well.
Yeah, and just on that note, I have the code for that widget, and I can just email it to you, and your IT guy can just install that. So that's really easy to do.
Exactly. Yeah, no, we have that. We'll get that up and running soon enough.
For sure. So real quickly, I'm going to be mindful of your time here. So has this changed the way you do dentistry? Like, are you seeing less patients in a day now, or are you still kind of operating the same way, just with a few more steps in there in terms of like donning and doffing PPE?
Yes, it really comes down to whether we're doing an aerosol generating procedure or not. And then also, like, I'm working out of 3 different ops. Before I was working out of 2 ops, and so the distance between patients is greater. And there's less crossover between team members, and so we are reducing that. but we are still seeing, like we're busy with patients, but we're probably not doing as many. There's probably not as much overlap between patients, so that's good. But what we're also trying to do is make the most of every appointment. And so if a patient needs to have, say, six restorations done, we're going to try and do that all in the same appointment, as opposed to breaking up into 3 and 3, because that means it's just one patient visit, and they can also get everything done within that appointment and back again. And so that is also more and it's more for us because we're able to do more within the same appointment. And that's pretty much what we've always tried to do in the past, but there's now one more reason for us to do it in this manner, just to reduce the number of trips, which will in effect help to potentially reduce any virus transmission.
For sure. When a new patient comes to you and to fill out, so say I'm coming to Dr. Nick Seddon and I have some forms to fill out. Now, have you guys digitized that process so that the patient doesn't need to actually touch anything?
Yeah, we have. So we actually send it to their phones or to their computers. We just email it to them. And so it's very easy to fill out with their phones. It has really nice graphics. And so each of the questions will have something to go along with that question, such as, do your gums bleed when you brush your teeth? And it'll actually show like a diagram of bleeding gums.
Cool.
And so when it's a friendly, quick process that takes 5 minutes if you're quick, maybe 10 minutes if you're taking your time, and it's really quite convenient because patients can do it from home in advance.
Mm-hmm. So that's cool. So I come to Oceanfront, or I find you guys. I say, you know what, I want to come see Dr. Nick Seddon. So I just check a box, and then you guys send the patient intake forms to my phone. I can do it all in 5 minutes on my phone, and then I can book my appointment right there and then. Don't have to touch anything. I walk in. Like it seems like you guys are really going the extra mile to make it really contactless, really streamlined, knowing that you can have a face-to-face conversation just like this. So say if I want to get clear liners, or if I need an implant done, or some cosmetic dentistry or something, I know that I can have that face-to-face with you before I even come to the office. Is that right?
That's right. Yeah. And the information we're given is the practice software system that we have also will pop up when we're going through our exam. And if they answered yes to a certain question during our exam, it will pop up at that specific time regarding their health or their dental issues. And so we're able to follow up with them at the appropriate time during the examination process. So it's really quite intuitive in that regard. And so it ensures that we're covering everything and really gives a really appropriate flow and efficiency to the exam process, to that whole new patient experience.
I love that. That's the way of the future.
Totally.
I think most dental offices are going to have to pivot this way, and it's the early adopters like yourself that are again, it's fun to watch you do it and to implement these new systems. So it's really cool.
Mm-hmm. And today we're just implementing our online payments so that patients don't even have to pay at the front. And so like that, it's on their phone, number of dollars, and they can just get at their own payments.
Okay. Can you say that part again? I lost you a little bit about the online payment.
Sure. What I was saying is that because of the contactless checkouts, what we're also implementing as of today with our practice management software system is we've actually switched point of sale service with a different company that's linked directly to the practice management software. And what that allows us to do is online payments. And so when the patient is finished with their appointment, instead of telling them, okay, you owe X number of dollars, please pay now, we actually send them a text. And then that text will say, you owe this much. And then they just click on their phones to pay, and they can pay it from their phone. And so that also just reduces the number of contacts, this time with the reception team.
That is so cool. Does it also tell them how much insurance coverage they have?
that because it's not linked directly to insurance. Insurance has a lot of privacy issues related to that, and so usually our billing system is separate from insurance. And so we'll send everything off to insurance, and then insurance will follow up with them. But unfortunately, within the Canadian system, it's not necessarily linked.
Right. Yeah. I think that just to go back on that, because the connection we're a little spotty, but just to say that no, the insurance is not linked yet, because in Canada it's not really done that way. But I think that there's going to be insurance companies going into the future here that are going to have that capability to link those services. I just don't think it's here yet.
Yeah, maybe it could just simply be our software system, or just the way that our office works. I don't know.
It's all new.
We're considered a non-assignment office, and so patients are to pay at the time of service, and then they'll be reimbursed by insurance.
Right, that makes sense. Cool. I got a couple of quick questions for you. Straight up dental questions. Is that? Are you still with me? I think we are both unstable, I think, at this point in terms of our connections. So it looks like you're back.
Yeah, I just noticed it got pretty choppy there.
Some choppy waters. Dr. Nick Seddon, what's a root canal?
Root canal, it says my internet connection is unstable. So root canal is where we remove the nerve of a tooth because it is either dead or really painful or has infected. And then we put an inert plastic material inside that nerve to seal it and prevent further infection down the road. And then usually once we do a root canal within that tooth and clean it all out internally, then we need to protect it with some type of crown over top.
Okay. So typically, like I know I had to have a couple of root canals done on my front teeth because I had taken a fairly substantial hit in hockey. So I guess like you could need a root canal after actually like not knocking your teeth out, but like even if you take like a blunt force hit to the face, like that could kill the roots of your teeth, right?
That's right, yeah. So a root canal can arise from one of two things. Trauma, which is what you're describing. That's when the blood vessel is disturbed and the blood supply is cut off to the tooth. And so if you fall or take a hit of some force or whatever to that area, and the blood vessel is cut, or it's called decay. Bacteria gets into the nerve, creates what's called a pulpitis, and eventually that tooth dies. So those are the two reasons why you might need it.
Might need a root canal, yeah. One last question for you, for all the parents out there, because and I'm just going off like a survey. I ask people like, what kind of questions would you like me to ask my dentist friends? For all the parents out there, how early should new parents start brushing their kids' teeth?
They should start brushing their kids' teeth as soon as they see teeth.
Okay, so
once the teeth come in, they need to start brushing them. I don't know if you necessarily need to use a toothbrush, but you could use a cloth, and you should also use some type of toothpaste with fluoride on it. A lot of kids' toothpaste have a reduced amount of fluoride because oftentimes when kids will brush with a fluoride toothpaste, that toothpaste, and that can create an upset stomach. But from the moment they come into the mouth, there should be fluoride applied to those teeth in the form of toothpaste. And so usually when the teeth first come in, you don't necessarily need, or you may not even be able to use a toothbrush. So that's why a cloth would be advisable. And a follow-up point to that, and you might even want to ask this question, is when should that baby come into the office for the first time? And the answer to that is 6 months after the teeth come into the mouth. So usually the teeth come in about 6 months or so. And so the average time when a baby should first come in should be at the age of 1.
Okay, so one-year-old is sort of the benchmark or the marker, but 6 months after, 6 months after teeth start showing up, or 6 months after you see it
showing up.
Okay.
Yeah, oftentimes I'll see patients come in, or parents will bring their kids at the age of 3. And that's because if they're taking good care of teeth, they don't have any. But I've also seen cases of where they come in at the age of 3 and they have decay and caries, and then all of a sudden we're in a bad situation where now we have to do some type of treatment. And in this case, I would certainly refer that child to a pediatric dentist, because we don't do a lot of pediatric dentistry in my office. I myself treat pretty much all adults, as my focus is cosmetics and implants. But the whole purpose of getting a patient in for the first time is really behavior management and making sure they have a great first experience, and then also informing the parents as to how to take good care of their teeth. And if you do that at the age of 3, you've lost 2 years of education for that parent. And so if they don't actually know that they're not supposed to feed their kid juice or milk all the time, and they should be feeding them mostly water, then by giving the child the wrong providing fluoride at an early age lead to decay, and then all of a sudden their first experience with the dentist is going to be a negative one.
Right. Okay, that makes sense. Hopping off of the topic of kids dentistry, how long would you say a clear aligner treatment would take on average? Is that
well, you can't really say it's an average. It really depends on the nature of the case. Sometimes, like we do mostly adult ortho with Invisalign, and sometimes that can mean we're taking out teeth and we're moving teeth significantly. Like I did a case where I had to remove 4 premolars and retract all the teeth back because the patient was complaining she had too full of a smile. And it turned out amazing, but it also took 2 years. But I've had other patients that complained of relapse from previous as a teenager. They didn't wear the retainer and so just wanted to get back to where it was because the teeth had relapsed. And that can take as little as 3 or 4 months. So it really depends. But I would say a lot of the patients that we see, I'm treating them on average between 3 and 9 months. So I'm doing very basic treatment. But what that allows us to do is I'm usually combining it with restorative treatment. And so I'm either doing straightening the teeth with some whitening and a little bit of bonding. So we're adding filling materials to different teeth to restore their natural tooth shape. Or I'm doing that with some type of composite or porcelain veneers. And so by moving the teeth beforehand, it helps us or prevents us from having to reduce the tooth any further, or it can just simply improve the function such that when we actually add tooth structure or add filling to the tooth to restore its natural shape, well, the way that the teeth come together will prevent it from chipping because it's in a more positive and protective position.
Right. Got it. Well, that's awesome. Fluorinated water or non-fluorinated water? What's your vote?
Non-fluoridated water in North America because we have access to fluoride in the shape of toothpaste. But the research tells us that in very poor areas where they don't have access to fluoridated toothpaste, fluoridated water is not a bad thing because it helps to strengthen children. So there is benefit to that. The epidemiological studies do support the use of fluoridated water, but in North America, where we don't really have that issue, where we have access to fluoridated water or to fluoride in the form of toothpaste, it should be okay.
Got it. Thank you so much for letting me ask you all these questions today.
Of course, my pleasure.
Yeah. Is there anything else you want to chat before I let you go and enjoy the rest of your day in Tofino? I'm sorry we ran so long, but there's a lot of good information here.
Not a problem. No, I have nothing more to say. But thank you thank you for having me. It's always a pleasure, Tyler.
Yeah, for sure. I want to do it again when we get a better connection because I want to start going a little deeper into cosmetics and ortho with you as well. So we'll definitely hop back on in the next couple weeks. If you
definitely, for sure, we'll do.
Awesome. Go enjoy your time and thank you for being here.